I learned about Verita Life through a friend. I was at a cancer conference in Kuala Lumpur, and I befriended another Scotsman there actually, and we were talking about the hyperthermia, and he had mentioned that he knew of a clinic in Bangkok which had hyperthermia, Verita Life. So I just had a look on the internet and saw what Verita Life had to offer, and decided to get in touch. And I came here to meet with Dr. Hosami, and we went from there. I was first diagnosed with the cancer in my parotid area in September 2012, so over 4 years ago. And I've had, since then, I've had 2 surgeries on this area, and also 2 radiotherapies, IMRT radiotherapies also on this area. Subsequently, I had some immunotherapy. This is Keytruda, and that proved to be effective to some degree. And then I had Keytruda with another chemotherapy, Avastin, which proved not to be so effective. And then I wanted to consider my options, and then I spent a few months considering those options, and then eventually came here. Upon speaking with Dr. Hosami, he was the only clinic that provided that multiple treatment approach. So that treatment approach consisted of a combination of chemotherapy and natural treatments, as well as hyperthermia. I was a little reluctant, and I've always been reluctant to take chemotherapy. I lost my father through cancer, and I saw him deteriorate very, very quickly with chemotherapy. So very reluctant on chemotherapy. So whenever chemotherapy came up, it was really off the table for me because I'd seen the side effects. But I learned more about IPT, insulin potentiated therapy, where chemotherapy would be administered in a much lower dose under a controlled environment. And upon speaking with Dr. Hosami about this here, I wanted to make sure that my treatment plan would be administered. It would be effective, but it would not influence or diminish my immune system. And this was something I was always worried about, because the research that I had done was that if the immune system is obviously depleted, then you're exposed to infection and even further metastatic behavior with your cancer. You're really giving the cancer the open door to travel. The chemotherapy given was the chemotherapy that came out in my my blood test report. So it was specific chemotherapies that had very high efficacy on cancer cell death and for my specific cancer. So very targeted for my cancer, which I'm very happy about. And the other natural therapies as well that came out from that test were also administered here at the same time. So with IPT, with chemotherapy, I've had the major and minor ozone treatment as well, which is building up the oxygen in my blood. That's also been very helpful. I've had a lot of natural therapies done. One, turmeric, which is a natural cancer fighter as well. Quercetin, also a natural cancer fighter. Vitamin C, cancer fighter. And really several other IVs as well, which have helped to boost my immune system, reduce the side effects of the chemotherapy, and fight the cancer. Side effects, that's interesting. The first week, nothing. The second week, I I was experiencing some nausea. I was experiencing a fair amount of fluid buildup. In total, I put on 7 kilos at one point when I was here, and it was mainly all fluid buildup. And this is only to be expected with the amount of IVs that I was given. But really, side effects were manageable. As I said earlier, I've been through radiotherapy before. The side effects for that were really quite horrendous. So nothing anywhere near as the side effects I had with radiotherapy. For me, I'm a little bit different because I came here fit. I came here with no symptoms. The tumours in my lungs are quite small. They're not giving me any breathing difficulties. They're not giving me any difficulties whatsoever. So for me, I wanted to come here and actually do something before these started to become a problem. I had been advised from a few oncologists, just wait until you start to exhibit symptoms and it starts to become a big problem for you. Are you crazy? I have to do something about this now whilst I'm still fit, whilst I'm strong, whilst this is still manageable. What happens if I have further, mets? I have to do something. So no, I came here very fit, and I'm leaving here very fit. At first, I was a little skeptical about coming to Bangkok to get medical treatment here because I've lived in Thailand for some time. I've seen some clinics in Thailand which are not so great. I've seen some hospitals in Thailand which are not so great. I've seen some hospitals which profess to be very professional, but in reality I've not been that impressed with the services and professionalism of some of them here. So I was a little bit skeptical. In fact, I was in two minds as to whether or not to come and actually come to this clinic to meet Dr. Hosami, but I did. I came here and I was very impressed, I have to say. This clinic here is definitely international standard. I've been to many hospitals around the world as well, but this is definitely of an international standard. I'm very impressed with the professionalism here. The staff here all conduct themselves very well. They're very friendly and very caring, and they're very organized. I'm perhaps mostly impressed by the doctors here because they have a completely different viewpoint than the doctors I've dealt with in, let's say, more of the conventional hospitals. Oncologists, and I've spoken to many, maybe around 15 oncologists, seeking advice and information and guidance and treatment plans on how to move further. And their views have always been very fixed, which I feel has been very restrictive for me. I've always wanted a more integrative approach to medicines. I've always to curing myself. I've known that there's always been natural therapies as well as conventional medicines that could help me, but most oncologists have really just they have no real confidence in any of the natural treatments. They think it's all quackery, and those kinds of discussions really were quite short discussions with me. So coming here and speaking with these doctors with the experience that they have and some of the success stories that I've learned of, even since I've been here in the past 7 weeks, seeing how patients have improved, and has just been a really heartwarming experience for me. Do it. I think I've been in touch with many cancer patients in this search for answers. I'm on many blogs, many discussion threads worldwide with people. I was just helping somebody in the US with a question she had this morning. And there isn't enough knowledge out there. The problem I find is that cancer patients go to the doctors, and doctors invariably always say, you must take this chemotherapy or you will die, or you must take this radiotherapy or you die. This is the only way forward for you. And patients don't seek a second opinion, and I think that's really where it falls down. Patients should really seek second opinions, and whether that's to confirm from another oncologist that they must take that chemotherapy is one way of looking at a second opinion. But I would say also seek a second opinion from alternative treatments as well, more integrative type solutions as well, because there is a lot out there, and from the research I've done, I mean, I'm not a doctor, I'm an engineer, but from the research I've done, there's definitely conclusive evidence out there that the combination of conventional treatments, which are still useful, albeit for me chemotherapy would always be in a low dose application. Immunotherapy is very exciting. That's very exciting coming through. Also good to keep on the table. But also some of these natural treatments as well, which are really not considered in a conventional sense, that can help with relieving the side effects of the chemotherapy, which it has done for me here, but also attacking cancer. It's been proven against my specific cancer that things like turmeric and vitamin C and quercetin have at least a 30 to 40% cancer kill rate for my specific cancer. So that, in conjunction with chemotherapy, hypothermia, and major ozone and other perhaps non-conventional treatments, this is all this multiple attack for the cancer, whilst keeping me in a healthy state. And I think that's what it's all about. For me, seeing my father, losing my father in 4 months to this chemotherapy attack was really heartbreaking for me. And I know now that if I knew now what back then that would be a different story for him. It would be certainly a different treatment protocol for him. So if I would certainly encourage any patient, any cancer patient, as I'm doing now, to really look at all the options before deciding on going down a certain path. And then when you do decide to go down a certain path, make sure it's your decision. Don't blame it on the doctor. It's your decision at the end of the day. Don't take the pressure from the doctor. Don't take the pressure from your family. It's your decision. I tell you without a word of a lie, I consulted 22 clinics worldwide, from the US, Germany, Mexico, you name it, UK, Singapore, Thailand, everywhere. And I didn't find one as good as Verita Life. I didn't find one that could offer such flexibility in treatments as Verita Life. And I just wish that there were much more places like Verita Life available around the world.